I have a fun way to remember the sign and symptoms in a case of Henoch-Scholein Purpura. So here, the H stands for hematuria, the S for a small child, the P stands for the palpable purpura on the buttocks. The last A in the purpura stands for the significance of IgA-mediated immune response. So I hope now you'd remember the key points in the case of Henoch-Scholein Purpura. The sign and symptoms would precede general malaise and fatigue in the patients. The sign and symptoms are usually as a result of the small vessel damage in the Henoch-Scholein Purpura. Always remember that the clinical picture starts from lower extremities and you have to focus on the rash, particularly on the buttocks and the lower legs. Joint pains, hematuria, that is blood in the urine, melena, that is blood in the stools, are also some of the signs and symptoms associated with this condition. The overall clinical picture would include an upper respiratory tract infection or gastrointestinal infection. I'll be describing all of these signs and symptoms in detail with you. Now let's talk about how the rash would look like. It begins as pinkish maculopapules that initially blanch on pressure and progress to petechiae or purpura. But the notable thing is that it is characterized clinically as palpable purpura that evolve from red to purple to rusty brown before they eventually fade out. Now this rash lasts from 3 to 10 days and specifically may appear at intervals that vary from few days to as long as 3 to 4 months. What is the cause of this rash? Damage to cutaneous vessels results in the local angioedema, which may proceed to the palpable purpura formation. Edema independent of purpura occurs primarily in the dependent areas, such as below the waist, over the buttocks, or on the back and posterior scalp in the infants, or in areas of greater tissue distensibility, such as the eyelids, the lips, the scrotum, or the dorsum of the hands and the feet. So this was all about the rash in such conditions. Now let's talk about the arthritis, which is the joint pain associated with these conditions. Now the arthritis presents in more than 2/3 of the children with Henoch-Scholein Purpura. It is usually localized to the knees and the ankles and appears to be concomitant with edema as well. The effusions are serous, not hemorrhagic, and they resolve after a few days without the residual deformity or articular damage. They may recur during a subsequent reactive phase of the disease. A very important symptom, which is quite noticeable in these children, is the abdominal pain. Intermittent abdominal pain that is often colicky in nature. There may be peritoneal exudates, enlarged mesenteric lymph nodes, segmental edema, and hemorrhage into the bowel as well. More than half of the patients have occult heme-positive stools, diarrhea with or without visible blood, or hematemesis, which is basically blood in vomitus. Intussusception, which is basically the torsion of the small intestine, may also occur in these patients. It is rarely found and is followed by complete obstruction, infarction with bowel perforation. So that was all about the clinical picture and what are the major signs and symptoms that we're going to look for in a patient of Henoch-Scholein Purpura. I hope now you'll be able to diagnose these patients in a better way.